Hello, everyone. Welcome to today's wellness webinar from Friends Life Care. Strengthen your core and become more balanced, presented by Dr. Brian Walls. My name is Maria Bueller. I'm the moderator. I'll be providing some housekeeping information before we start to ensure you know how to participate in today's event. Here's a screenshot that shows an example of the attendee interface. You should see something that looks like this on your own screen in the upper right corner. You're listening in using your computer or tablet speaker system by default. If you prefer to join over the phone, just select telephone in the audio panel and the dial-in information will be displayed. You will have the opportunity to submit questions and comments during the presentation by typing into the questions pane of the attendee interface, and we encourage you to do so. Please send in questions or comments at any time during the presentation. Brian will be able to respond to some questions during the actual presentation and can also follow up after the webinar. I would now like to introduce our presenter, Brian Walls, Senior Director of Care Coordination at Friends Life Care. Brian earned his doctorate in physical therapy from the New York Institute of Technology and his BS degree in exercise science from Wake Forest University. He's taught a nutrition and anatomy course at Chestnut Hill College in Pennsylvania and authored a book, Exercise for the Athlete Within, to help individuals learn how to improve their movement and everyday activity. Brian's currently a fitness coach and award-winning weightlifter. He's an active member of USA Weightlifting and the National Strength and Conditioning Association. Truly, he's someone who lives what he teaches. Dr. Brian Walls.
Oh, thank you very much, Maria. That's very kind words, and looking forward to be able to speak to everyone today about this exciting topic, and, well, I feel exciting topic. I do want to give a little precursor that really for years with working with many clients and many patients, that I had many patients who would say, you know what physical therapist truly means? It means personal torturer. So hopefully everyone today will, when we're doing some of the exercises, won't feel that I'm your personal torturer. So without further ado, let's get started. So the goal for today, we have a number of goals lined up for everyone. First, it's to learn about the cost of experienced falls. And it's really the medical cost that when you have a fall, what happens. Second is to learn what makes up the core muscles. And I really am going to ask some questions of each and every one of you, and please remember to ask questions in the question box at any time, and I will make sure to answer one, maybe two questions, and then of course, if there are any more questions, we can always continue this discussion offline, and I'll make sure that you, everyone will take down my email address and feel free to email me later. Third is to learn about the effect of weak core muscles. And then lastly is to learn how to reduce our risk of falls, our possible risk of falls through strengthening our core muscles. And keep in mind that our ultimate goal today is to reduce the risk of falls. I wish I could tell everyone that there's just one exercise that you can do and lo and behold, that's going to stop us from experiencing a fall. Or I wish I could tell you that maybe we should all just walk around in bubble wrap every day. I think on a day like today, if you're in the East Coast or actually most of the country, it's about 90+ degrees, so I don't think we want to walk around in bubble wrap at all. But really, it's a lot of exercises and a lot of little things that we can do now that will help us out later. So I ask, what are some activities that may lead to a fall? Please, in the question box, just write down what some activities are that may lead to a possible fall. So I see some answers coming through. One person mentioned, slipping on ice. Wow, that's definitely something that may lead to a fall. Walking down the stairs in socks. Oh, Jerry, that is a great answer. That is so true. So many people have slipped downstairs while wearing their socks, and a lot of us have these hardwood floors, so please be careful. Standing on a chair, Barbara, so many times people come in and they say, you know, I had a fall because I was trying to reach for a glass in the upper cupboard and I decided to pull a chair out and stand on it. Please, that is clearly a fall risk. And so please try to use a stool, try to use a stepper. And if I may say that I'm really lucky enough to be doing this webinar through Friends Life Care, and I know that a lot of the care coordinators, actually every one of the care coordinators, will do a falls risk reduction and a home assessment and will walk around the home to point out areas that are possible fall risk. So thank you so much. So what are some of the costs of having a fall? And once again, in the question box, just what are some costs that come to mind when you experience a fall? And once again, wow, everybody is really on top of it. I love what I'm seeing. Loss of control. Thank you, Jennifer. That's a very good one. That's a cost. Oh, wow. Cracked ribs, Kyle. That is a major cost, and that's something that we are all very afraid of. Maybe cracked ribs or a fracture. And Jerry, lack of mobility, very true. And, you know, so we have a lot of, everyone's answered some great answers. You know, we have what I like to call the FEP of falls, the financial, emotional, and physical cost of falls. And what Jerry and Kyle and Jennifer each mentioned are some of the physical costs of falls, but there are financial costs and emotional costs that we do experience. So we'll start talking about some of the financial costs that we actually have whenever we have a fall. And I have another question. As I mentioned, I like to really ask everyone questions because I know we know a lot about this topic. We may have experienced falls ourselves. But what does everyone think may be the total medical cost per person? Is it $350? $3,500, $35,000, or $350,000 if we experience a fall? Oh, wow. See, some answers coming in. Some people are thinking it may be $3,500. The medical cost may be if we experience a fall. Up. Oh, wow. Okay, I'm seeing a lot of the correct answers. Well, Bobby, I'm going to name everyone. Bobby, Judy, Jennifer, Claire, and Jerry, you are all correct. $35,000 per person when you experience a fall. So the medical costs can really skyrocket quickly if we experience a fall. And so you may ask yourself, why so expensive? And the reason for this is that we have physician costs. We have hospital costs. You know, that hospital bed costs a lot of money. There's a lot that goes into that. There are the professional costs. So the nurses, the physical therapists, the occupational therapists, each one of those skilled professionals that come in, that costs a lot of money. Any medical equipment that may be necessary, be it any medical or equipment modifications that may be necessary, that costs money. And perhaps there may be certain drugs that you have to take following the fall. That is very expensive and adds up over time. What's amazing is that in 2013, the total cost in the United States, medical costs, was $34 billion per year. So really, falls are very expensive, not just for us individually, but also nationally. So it's really everything that we can do, every little thing that we can do to cut down on the risk of experiencing a fall will help us out in the grand scheme of things. So we also have, as I mentioned, the E of the FEP are the emotional costs that we have. And some of the emotional costs that we experience happens to be loss of confidence and the loss of interest in activities and then the loss of independence. And that is, the last one is one that I think we can all take to heart and keep in mind, that we all want to remain as independent for as long as we can. But even though we may experience these three losses, it's important that we overcome our fear. And I'm a big acronym person, and so I really, when I see the word fear, I think of it as more of fun exercises that are appropriate to reduce the risk of falls. So we all have to overcome that fear that we may experience, because just as we were learning to ride a bike, we may have experienced a fall, or we may have experienced a little bit of uneasiness, but we've got to get back up on that bike. We can't let that bike stop us from experiencing that exhilaration. Just like the two individuals that are right here on the slide, they're having fun biking down the street, and you know, I think we all should have fun biking down the street. So I see a wonderful question here. Chuck, which is the best balance exercise to avoid falls? Well, you know, Chuck, I'm going to make sure that we get into that question a little bit later on, but you know, one of the first balance exercises that we all do, believe it or not, is just walking. The more we walk, the better. But I'll talk more about that later on, Chuck, and thank you so much for asking that question. So we've been talking about the financial cost, but I noticed when I first asked that question, a lot of people had physical costs listed, cracked ribs, for instance, and that, of course, is a physical cost. So I ask us all this question, and I ask myself this question regularly: when did you begin to fear falling? And for that matter, what triggered your fear of falling? So just take a moment, put your answers in the question box. So when was that moment where you said, I really do fear falling? And there's some wonderful, wonderful answers coming in, excuse me. You know, one person mentioned when they experienced a fall while ice skating. I can understand that one. Oh, wow, a loss of sense of balance. That's one I think a lot of us share. You know, I take a little personal story, is that I recall I had a fear of falling a few years ago. I just realized that my balance was not what it was used to. And I actually started to do yoga to make sure that my balance became stronger. Oh, wow. Thank you so much for sharing, everyone. I see one more response, that after the first fall as a result of a freezing caused by Parkinson's. Thank you so much for sharing. And that is an understandable fear of falling, and that is actually a topic that maybe we might do a part 2 of looking at exactly some diagnoses that may lead to fear of falling, and also what are some exercises that may help to reduce the possibility of having a fall. So what are some injuries that may occur from a fall? And I know some people had mentioned earlier, I believe Jerry had mentioned fractured ribs. And I know that a lot of us may have experienced certain bumps and bruises. Matter of fact, just by asking this question, one person actually just said, thank you so much, Jen, for mentioning that it's bruising. And yes, bruises are common injury when experiencing a fall. And that is something that we do need to be careful of. Now, believe it or not, we're all sitting on probably one of the best cushions to help us when we have a fall. And so it is important that we do work on that area, but we'll talk about that some more later on. So when we have, as I mentioned, and a number of us had already mentioned, that there are a number of fractures that we may experience when we have a fall. So there's something that's called the fracture triangle. And in that, there's the relationship of the fall, the force of the fall, and the fragility of our bones. So we'll take a moment and just talk about this fracture triangle, which, as I mentioned, it's the first part of that triangle is the fall itself. And the fall may be a result of changes of muscle mass and body fat. Now, I'm going to take a moment here and I'm going to tell everybody something that I hope you're happy to hear. Fat is good. Fat is very good in this case because fat is our cushion. There's a lot of things that fat happens to do, but this case with falls, it helps us with cushioning ourselves when we experience a fall. As I just mentioned, we're sitting on an area that has some fat there, and that's why it's comfortable to sit there. But it's also important to recognize that we do have a change of muscle mass when we age. And that muscle mass may be, the degradation of the muscle mass, may slow down over time with exercising. And we'll talk some more as we go on. The force of a fall is really how hard somebody has a fall. What's the angle the fall happens to be? Of course, if you may fall from a step, from the stairway, then the angle is going to play a huge role in what type of fracture you may experience. And last, but not least, is the bone fragility. It's basically looking at how strong are our bones. You know, with exercise, any type of exercise, and especially resistance training exercise, we end up strengthening not just our muscles, but also the strength of our bones. So lifting a few pounds here and there is very important. I don't expect anybody, any one of us, to all of a sudden start lifting a car. You know, that is something that, please don't go out there and just do that, but it's okay to do the sit-to-stand test that I know a lot of the care coordinators at Friends Life Care happen to do on a regular basis. So once again, with physical cause, some of the most common injuries that we experience happen to be a broken hip. 95% are a result of a fall. Probably the second most common injury that a lot of times we don't anticipate is a traumatic brain injury, which occurs 40% of the time from a fall. So it's not just the fractured hip, it's also the TBI, as we like to call it, or maybe concussion. I know many of us are, if you watch sports, and especially if you watch American football, you're probably aware of the risk of concussions with a lot of American football players. Of course, just not American football players, a lot of athletes that play sports. And believe it or not, that the concussions that they experience are concussions that we may experience when we have a fall. Now, when we look at the leading causes of traumatic brain injuries, as I mentioned, it's falls that actually are the result of that. What's interesting is that this is true regardless of our age. I just want to take a moment and mention to everyone, it's common to think that, oh, well, falls are something that we just need to worry about as we are over a certain years of age. Actually, falls are something we're concerned about from the moment we start to play in the playground. We're always concerned about falls. Now, granted, as a toddler, the way we learn how to walk is we have a little bit of a fall. And it's okay because we encourage the toddler to get up and walk. At 21, we may have a fall and maybe a very severe fall, and something that may lead to a TBI, a traumatic brain injury. So what's fascinating is that between the ages of 0 and 14, 55% of all traumatic brain injuries are a result of a fall. As I mentioned, they're learning how to walk, but as we get closer to the age of 14, then we start to become a little more concerned. Over the age of 65 years of age, 81% of traumatic brain injuries are the result of falls. So that is something that we do need to be cognizant of. I mentioned earlier that about the bone health, the bone strength, and I just want to take a moment and point out that our peak bone mass happens to be around the age of 30 for both men and women. And then after the age of 30, we start to experience a slight decline. Now, granted, this graph is just a very general graph, and each individual is an individual. So everyone's going to be different. Now, with resistance training and exercise, you can slow this down and you can slow the bone loss that we happen to experience. If you do and have any bone loss or you're concerned about bone loss, please reach out to your primary care physician and ask your primary care physician about a bone density test. The most common test is called a DEXA test, which is a dual energy X-ray absorptiometry. And that normally will measure the bone strength of the spine, the hip, or the total body. So please reach out to your primary care physician about that. So about the physical costs as we're wrapping it up is the fact that it is worldwide the second leading cause of accidental death around the world. 37.3 million falls per year. Many of the falls may be due to occupational hazards, but also many falls are due to what's happening within our home, and maybe we can actually look out for those little trip hazards, and that's where it's very important when utilizing individuals, care coordinators, professionals, occupational therapists, physical therapists that come into your home and that may look at what are those cords or rugs that may be up that we need to really be careful about because they can be fall hazards. So let's take a moment, let's take a little posture break here, because I'm sure if you're like me, you may be right at your computer and you're finding that your posture, you're starting to begin to slouch. So believe it or not, this is our first core muscle exercise. So just like the woman in the picture, what I'm going to ask everyone to do is to sit up. You're going to move your tush back to the back of the chair. We're going to have both feet planted flat on the floor. We're going to take a deep breath in through the nose and bring our shoulders back and exhale and start. Let's do that one more time. Deep breath in and try to sit up even taller. Bring those shoulder blades back and exhale. Let's see. Hopefully, please, in the question box, let me know how you feel. We should be more upright. Hopefully our shoulders are back in a very good posture and really feeling a little bit more awake, because I know we've done a lot of academic work, if you will, and we're going to start moving slowly into more of the exercise portion in the next few minutes. We're going to move a little bit. But right before we do, I do want to ask everyone, what are some of the physical weaknesses that may lead to a fall? Now, there are some answers right here. Please, in the question box, answer the question. What are some? Judy, I see that's a good answer. I'm not going to say it just yet. I'll let a few other people come in. Oh, wow. Actually, somebody mentioned one that's not on there, but before, so someone actually just mentioned medical and taking drugs. That actually certain drugs may lead to a fall. But Judy and Sue, you are 100% correct. All of the above may lead to a fall. The area that we are discussing right now are the weak core muscles. So weak core muscles, and thank you so much for Corinne for answering that as well, all the above. So weak core muscles, how can they lead to a fall? Well, in order to understand how weak core musculature can lead to a fall, it's important to understand first, what are our core muscles? So does anyone out there want to answer in the question box, what are the core muscles that we have? Now, a lot of times we like to say the core muscles they're just one or two. Oh, Ellen, thank you so much. So weak core muscles, Ellen said our abs. Again, Bobby, our abdominal muscles. Oh, Sue. Sue, Jerry, I love the answers. Our glutes, our abs, our ribs, our hips. Kyle, our abs and glutes. Everybody is hitting the different areas of our core muscles. Wonderful. Oh my gosh. This is, I gotta tell you, as a professor, everyone is on point, 100% here. So our core muscles, as everyone has mentioned, actually are our abdominal muscles, but they're also our glutes and our hip muscles. So we have interior core muscles and we have posterior core muscles. Our interior core muscles consist of our rectus abdominis, transverse abdominis, internal obliques, and external obliques. So let's take a moment, look at our anterior core muscles. I always like to say that my core muscles really look like a big keg, especially when it comes to my rectus abdominis. I always hope that my wife always enjoys that I have a keg, but I don't know. That's why I work on these so hard. So the rectus abdominis, sometimes called our six-pack, or as I mentioned, I like to call my keg, helps with forward trunk flexion and also helps with assisting with breathing. Our external obliques, those are our side muscles. They're our turning muscles, and they will help to turn and rotate the trunk and also assist with deep breathing. And please, if you have questions, feel free to ask in the question box, because we're going to go through these a little quickly, but feel free to ask questions. Our internal obliques are, once again, side muscles. These are a little bit deeper than our external obliques. They're our turning muscles, and they will assist with rotating the trunk and also with forced respiration. And our last anterior core muscle is our transverse abdominis. This is a muscle that I like to refer to as our internal weightlifting belt. And this helps to stabilize the pelvis and the low back. Now we have our posterior core muscles, and there are latissimus dorsi, our rectus spinae muscles, and our gluteal hip muscles. And as I mentioned, and when I asked the question, everyone was hitting on different muscles of the anterior and posterior core muscle group. So we have the gluteal and hip muscles. These are sit muscles. We're all sitting on them right now. And they are hip extensors, which mean they are going to help us to stand up. We have our rectus spinae muscles, and they are our back muscles, and they will assist us with posture and extension. And then last but not least is the latissimus dorsi, very large muscle, commonly referred to as the swimmer's muscle. If you have watched the Olympic trials and have seen Michael Phelps and all those other swimmers, you'll notice that they have very pronounced latissimus dorsi muscles, and they are very, very good at that. And they help with extension, rotation of our arms. So with this, and we put the anterior and posterior core muscles together, they all function to help us breathe. They help to protect our internal organs. They help with trunk flexion and extension, and also postural support and balance. So let's take a moment and say, well, with balance, how are they helping out with balance? Well, if you have a weak core musculature, your posture is going to start going forward. And when you start moving your posture forward, that means you become top heavy. That leads to an increased chance, an increased risk of experiencing a fall. Be it a fall when you stand up out of a chair, be it a fall as you're just walking down the steps because you're so forward. And because the core muscles don't just encapsulate just the anterior core muscles, but also our gluteal and hip muscles, keep in mind that when those glute muscles and those hip muscles are weak, we're going to have a very difficult time standing up. We're going to have a difficult time standing just on two legs, let alone one leg. And once again, this may be a topic for a future webinar, is the fact that the art of walking is so that when our hip muscles and gluteal muscles are weak, that we have difficulty just taking one step after another. Now, take for a moment that if we have a tightrope and we're walking on that tightrope as we're walking, as we do every day from place to place, that believe it or not, for a split second, we're actually on one leg for that split second. And if that one leg happens to be weak and any of those core muscles happen to be weak, we end up with a very weak link. And that may lead to an increase of experiencing a fall. Now, with these core muscles, and each one that we mentioned, these are muscles that are actually endurance muscles. So they are always working. They're always keeping our posture perfect. Now, many years ago, I started to write a presentation and presented a presentation actually about the things that our parents would say that are very helpful in our day-to-day life. And one of them happens to be, get those shoulders back, sit up straight, believe it or not. I hope everyone just right now got their shoulders back and sat up straight as I said that. And I myself just did that as well. So, but it is important to recognize that when we have those core muscles, they may be weak. We are now hindering our ability to actually do a number of activities that we may love. For instance, what are some activities that may be affected when we have weak core muscles? And please answer in the question box. Seeing some really good answers coming in. Jen mentioned making a bed. That is very difficult to do if you have weak core muscles. You know, bathing. That is bathing, believe it or not, and with every patient that I have worked with, that has always been a very difficult activity to teach someone. Bobby, carry heavy bags. Very true. When your core muscles are weak, to carry heavy bags becomes very difficult. That really does. That really does. And Jennifer, house cleaning. So basically, we're seeing a lot of day-to-day activities that really, if we have strong core musculature, we'll be able to actually do a lot easier. And as we're mentioning, and as this gentleman that is balancing on this chair, and I assure you, his core muscles are very strong. His posture, believe it or not, is very good. But weak core muscles contribute to decreased balance, poor breathing, and poor posture. And so we really want to get to the point where we can balance ourselves standing up, not so much balancing or doing a handstand on a chair, please. I do not recommend that, but definitely standing up and having a strong core, or even sitting, as we're all sitting here, and having a very strong core. So let's see, what are some of the exercises that we can do to help strengthen ourselves? Now, and I do want to just take a moment and mention that with the exercises that we will go over, please, I implore every single one of us to make sure that you get the green light from your primary care physician before doing any exercise. And the exercises, we're going to start off from very basic exercises to more advanced exercises, but only participate where you're comfortable, and please, please make sure that you get the okay from your primary care physician, and also make sure you're wearing sneakers. As somebody mentioned earlier, that wearing socks may lead to a fall. Doing these exercises in socks may lead to a possible injury, and we do not want that. So with exercising, I want us all to think about it like a bank safe vault, that the more we start to save, the more exercises we start to do today will help us out 10, 20, 30 years from now. Or in that matter, you'll start seeing some of the return 10, 20, 30 days from now. But just doing a little goes a very, very long way. So please take a moment. You don't have to answer this right now, but you're welcome to always put an answer in the question box. what are some of the activities that you used to do that were so much fun? You know, I can tell you there are some activities in which I used to be able to do a handstand, and I've been working really hard for many months to do a handstand, but I'm trying to do it, and every day I do work at it. But I'm seeing some people say jump rope. That's very good activity, extremely good activity. And rowing, that's a wonderful activity. If you live by the Schuylkill, you see rowers all the time. Sue, I see you're kayaking, wonderful. And Judy, you're right, jogging. That is a great activity, and a strong core really helps with jogging. So just wanted to take a moment and everyone read this little caption that the handle in our recliner does not qualify as an exercise machine. I really wish there was a recliner out there that did all the work for us, but regrettably there isn't. We have to actually do a little bit of movement, and we have to sweat a little bit. So without further ado, we are going to move. Although doing this exercise, I'm starting to wonder with some of these pictures, some of these people doing these exercises, I really want to meet them because I think I need them to train me. They really have great, strong core muscles. Let's do a few fun exercises that are appropriate and that are going to lead to falls risk reduction. So just a quick reminder of some of the muscles that we're going to be working here. We have our anterior core muscles, our rectus abdominis, our transverse abdominis, internal and external obliques, and we're going to work our posterior core muscles, our latissimus dorsi, our erector spinae muscles, and our gluteal and hip muscles. So now let's pump you up, and that's what we're going to do, just like Hans and Franz here. And first, we're going to start off with the balloon exercise. And this is actually an exercise that is found in my book, Exercise for the Athlete Within. And so this is a fun exercise to first teach us how do we actually breathe. So just like the posture exercise, let's push our tush back into the back of the chair. We're going to have our feet firmly planted on the floor, and let's first take a deep breath in to get in a nice, perfect posture. So deep breath in, bring those shoulder blades back, and exhale. I'm sure you all just heard me breathe right now. And so now we're going to put our hands, interlock our hands, and put it on our stomach, just over our belly button. And we are going to blow up our stomach very much like a balloon. So take a deep breath into the nose and blow that balloon up. Deep breath in and exhale. And we'll do this 2 more times. Deep breath in and exhale. And 1 more time, you should realize that your stomach is starting to really get nice and big. And exhale. Believe it or not, we're using our anterior abdominal muscles, core muscles, to actually do that exercise. And this is a great exercise to do while you're sitting down, and even better exercise to do while you're laying down, that it may actually help you to relax. And to maybe, if you're having difficulty sleeping, maybe you might even want to use it to help you go to sleep. That's why it's really important that you do it while sitting down or lying down. Do not try this exercise while you're using heavy machinery. I see Corinne has asked the question, how often do I recommend doing these breathing exercises? We should do these every day. These are very good exercises that we can do every day. It will help your breathing, not just every day, just breathing while you're working, but as a few people mentioned that are kayaking, still jogging, these are great exercises that are going to help you do these physical activities that each and every one of us love to do. Thank you for asking that question, Corinne. Wonderful question. The next exercise we're going to do is exercise I call the red light exercise. This is an exercise, believe it or not, you can do while you're driving. So we have a picture of a steering wheel right here, and I want us all to take a moment, still in that perfect posture position, feet on the floor and back against the back of the chair. And we're going to put our hands at the 9 and 3 position on the steering wheel. And let's pretend that we're at the red light, and now we're going to take a deep breath in and exhale, and upon exhalation, we're going to bring our belly button back to our spine, and we're going to hold that position while still breathing. Please, everyone, keep breathing. We're going to hold that position until the light turns green. So let's pretend it's just a 5 second, 4, 3, 2, 1, and release. The light is green, and we go on about our business. This is a fun exercise to do as you're driving about town, going from place to place. So that way, if you say that you always have difficulty doing core muscle exercises, well, believe it or not, you can do them right at the stoplight. And this is important to keep in mind, safety first, always safety first. You know, look both ways before you go through that stoplight. But this is a really fun exercise, and it is important to keep breathing as you're doing this exercise. So now, we're going to move on to seated woodchucks. Now, this is an exercise you definitely cannot do at the stoplight. So this exercise, please wear your sneakers. Also, perform this exercise in a very open area. There should not be a lot of clutter around you, no lamps or television. I actually, years ago, had a client who tried to do this exercise on their own, and they did it by their television screen, and they knocked over their television. So please do not do this by your television at all. And keep in mind, although the individual in the picture they're sitting on a stability ball, you do not have to do this exercise on a stability ball. You can do this exercise in your dining room chair or at your office chair. So when doing this exercise, we're in a perfect posture position, so both feet on the floor, and if you notice, the individual is very upright, good posture, so that means take a deep breath in and bring those shoulder blades back, in, shoulder blades back, exhale, and we're going to start with our hands. You do not have to use weight. You can actually just clasp your hands together, start by your right hip, slight turn, and deep breath in, and then exhale as you're bringing your right arm and left arm over your left shoulder, and then breathe in on your way back down, returning to the starting position. As you can see from the arrows, this exercise is going to work the erector spinae muscles. It's also going to work the internal and external obliques. So we'll do this exercise for 5 repetitions. So back in the starting position, we'll start on the right side. We'll do just 1, and then back down, and then 2, and back down, 3, back down to the starting position, 1 more, and 4, and then back down in the starting position, and then we switch sides. So, of course, you can add light weights, and I strongly recommend to add light weights when doing this. Always good to start off with 1 or 2 pounds, and then slowly build up to a comfortable weight to be able to do 3 sets of 10 repetitions when doing this exercise. Now, of course, if you feel that seated woodchops are pretty easy, well, then we move up to more of a standing woodchop. When you're doing this exercise, please wear your sneakers. You cannot do this exercise wearing your socks. You will slip all over the place. That I can tell you I have done myself. And so please wear sneakers, and it's the same movement with the exception of now we're adding a squat. So our feet are shoulder width apart. We're going to have our hands clasped together, and we're going to sit down in a seated position or just as far down as you can get comfortably. Hands to the right side of the hip. Now deep breath in and exhale, and upon exhalation, you're going to stand up and slight turn, bringing your hands over your left shoulder, and then inhale on your way back down into the starting position. And we'll do 2 more of these for those who may be doing these exercises with us. So back start position, now up and back down, and 1 more time, up and back down. Keep in mind, technique is what is most important here. It's not important to lift heavy weight. Now, I've been in gyms and clinics for many years, and so many times I've seen people actually try this exercise with extremely heavy weights and their technique is thrown off. It is very important that you keep your technique perfect on this. So let's move on to the next exercise, which is the half wall sit. If you notice, the woman in the picture, wearing sneakers and wearing a nice workout attire as well. And so please place your back on the wall. Feet are shoulder width, about a foot or two in front of you, and your hands can be placed on the side of your body, or they can be placed on your hip. Doesn't matter. Slowly lower yourself down so that way your knees are slightly bent, and you're going to hold this position for about 5 seconds, 5 to 10 seconds. And then after the 10-second mark, stand up. You should really feel this exercise in your gluteal and thigh muscles. And if that becomes easy, then we're going to take it up another notch. We're going to take it to a full wall sit. And it's the same position with our feet. We're going to have our feet 1 to 2 feet in front of us, shoulder width, our back flat on the floor. Now, in the case of the individual in the picture, you don't have to have your arms in front of you. You know, when I was an athlete, my coach would actually put 45-pound plates in our hands and say, you got to hold it in front of you. And we would do it because we were afraid of our coach. So you don't have to do that. I don't recommend that. You can actually put your hands on the side or on your hips. And you're going to hold this exercise, this position, for 5 seconds. And then you're going to stand up. This is a lot more intense than the half wall sit that we did before. And as you can notice, we're actually going to hit a little bit more of our anterior core muscles, and you're really going to feel this in our gluteal and thigh muscles. To further work our posterior core muscles, we have the bridging exercise. This is a wonderful exercise to do on the floor, and start off on the floor that you're going to have your back flat on the floor, your knees bent, and your feet flat on the floor as well. Hands to the side, and you're going to take a deep breath in, and then exhale, and upon exhalation, lift up. And so that way your gluteal and thigh muscles are raised above the ground. And then you're going to lower it back down. And once the gluteal muscles touch the floor, you're going to lift back up again, pushing through your heels, really squeezing your gluteal and thigh muscles. Now, a little bit more intense, anterior core muscle exercise are actually doing planks. In this case, we're going to do a progression from a wall plank in which we get into a push-up position, hands shoulder width apart, our feet about 1 to 2 feet back away from the wall, and then we're going to slowly lower yourself to the wall so your elbows are touching the wall. Take a deep breath in and exhale and hold that position for 5 seconds. And then you're going to release. Then do that again. Now the goal is to get up to be able to hold the position for 30 seconds, 2 sets of 30 seconds. And if that becomes a little bit increasingly easier, then we'll progress to doing a floor plank. Now, I'll just go back for a second. You notice that with the wall plank, we're really hitting the anterior core muscles. And now with the floor plank, we are hitting not just the anterior core muscles, but our posterior core muscles. And so it's the same position as the wall plank. We get into a push-up position, and keep in mind, this is an advanced exercise. So we're in a push-up position, hands are shoulder width apart, we're on our toes, and now we're going to put our elbows underneath our shoulders, lifting our body up on our shoulders and our toes, holding this position for 5 seconds. After 5 seconds, lower yourself back to the ground. The goal with this exercise is actually be able to hold it for 30 seconds. That is a very, very good goal to have, but you want to slowly build up at 5-second increments. Now, we're in the more advanced section. As we start off with planks, we're going to do an exercise that I like to call Superwoman or Superman. And this is an exercise that you do while laying on the floor on your stomach. And you're going to have your arms raised above you, your feet and toes pointed behind you, about shoulder width. And then take a deep breath in, and on exhalation, you're going to lift your arms and your feet off the floor. And you're going to hold that for 5 seconds. This is a great exercise for working our erector spinae muscles, our gluteal muscles, and our posterior thigh muscles. But this is, as I mentioned, this is an advanced exercise, and it is important that you do this on a hard surface. Oh, I see a question. Sue, plank should be, oh, yes, Sue. So Sue is asking questions, should the back be straight when doing a plank? And I'm just going to go back to that. And yes, Sue, the back should be straight when doing a plank. Thank you so much for asking that question. It is, as with all the exercises, technique is very important, that we keep our back straight with this. If you feel that your back is starting to sag, or you get into what I like to call the angry cat position, where your back, you have a hump, then you need to either lower the amount of time that you're holding this position, or you need to actually lower your tush down so that way your back is nice and straight. Thank you so much, Sue, for that question. I see we have another question regarding the Superman. Lift hands and feet on exhale or inhale. Thank you. Lift hands and feet on exhale. Judy, lift hands and feet on exhale. Thank you. So you're going to take a deep breath. Inhale, then exhale, lifting the hands and feet up and holding for 5 seconds. Wonderful questions. Thank you all. And for our last exercise, we have the lunge. And this is one that really we want to start off with using a chair, just like the individual in the picture is using a chair. She has her right hand on the chair. You will have your left foot in front of you, dropping back the right foot. And so that way then the right toe is just touching. And then you're going to slowly lower yourself down to the floor. You don't have to have your knee touch the ground, but just slowly lower yourself, stopping about 2 inches above the ground. And then stand up. On this one, once again, you want to take a deep breath in, exhale on the way down, inhale on the way up. You will feel this exercise in your anterior, posterior core muscles. You'll probably, if you're like me, you'll probably really feel this in your thigh muscles. But it's a very, very good exercise for all of us to do. Now, with all these exercises, it ultimately becomes a balancing act. How do we add in all these exercises into our daily routine? And it's important that we want to start off slow. We want to start off with a more basic exercise and build up to the more advanced exercises. And as I mentioned, please talk to your primary care physician prior to starting any exercise routine, and always wear sneakers when performing these exercises. It's very important that we do promote and we act safely first and technique first. So today we had our goals about learning about the cost of falls, the FEP, the financial, emotional, and physical cost of experiencing a fall. We learned about what makes up all of our core muscles. We also learned what's the effect of having weak core musculature. And I know that we all learned about some exercises that may lead to strengthening our core muscles. And I want to just take a moment for everyone to remember that leaves are supposed to fall. We are not supposed to fall. So let's really work hard to make sure that we try not to experience a fall and reduce the risk of falls. So please, any questions, and there have been so many wonderful questions that we've had throughout this entire webinar, but please feel free to ask a few questions. And please, place them in the question box. I see one person asked, oh, Jennifer, thank you. Will this presentation be available after the webinar for viewing? The answer is yes, it will be available. And please, by all means, go back, listen, and of course, you can always reach out and ask me questions. Do you have a handout describing exercises? There is actually a handout up on the dashboard that you may see just right above the question box, I believe. It says handouts. It's one of 5, and feel free to print them out. What time of day is best for doing exercise? Janice, that is such a tough question because everybody has a particular time of day. And first thing, when it comes to time of day to do the exercises, it really comes down to when you feel most comfortable doing exercises. Now, that can be, for some people, that can be at 6 o'clock in the morning just after they woke up. For others, they like to exercise at the end of the day to kind of bring themselves down from maybe a hard day at work. You know, scientifically, there are certain times of the day where our heart rate may be a little higher than other times of the day. When that heart rate is a little bit higher, that's a great time to work out. On days like today, when it's 90 plus outside, at least in the East Coast, I highly recommend that you work out early in the morning or late at night, or if you are going to work out in the midday and that's the only time you have, then work out in an air-conditioned facility. So thank you so much for that question. Chuck, yes. So what balance exercises should one do? So one exercise that actually we finished off with, which is a wonderful balance exercise, is the lunge. That is a very, very good exercise that we can all do to help us to increase our balance. And as Judy asked, the lunge, we lower ourselves down on the inhale and exhale or the inhale. Exhale or the inhale. So really, we can lower ourselves down on the exhale and stand up on the inhale. The main thing to remember with doing these exercises is that you have to keep breathing. Please keep breathing. To get back to Chuck's question now, another great balance exercise, and I don't want to get too much into this because I think this will be another webinar later in the year, is the fact that you can always just stand in place, believe it or not, and that's a great balance exercise. There'll be more questions. I'd love to keep this conversation going on after offline that we can even continue to do. And I see some more questions, but I don't want to take up too much of our time, so I know we're getting close to the end.
Yes, thank you. Thank you, Dr. Walls. And thank you, everyone, for attending today's webinar, Strengthen Your Core and Become More Balanced, or as I like to call it, Walls on Falls. Once you leave today's webinar, you will receive a survey. We'd really appreciate it if you could provide your feedback so we can continue to improve in the future as we bring more wellness webinars your way. You will also receive a follow-up email within 24 to 48 hours with a link to view a recording of today's webinar. You can view the webinar again or share it with others. And as Brian mentioned, there is a handout available as a copy of this presentation that you can download right from this dashboard. Thank you and have a wonderful rest of the day.